Learning you have to have surgery is frightening, but when it's surgery involving your spine, your nerves, or your brain, a lot of questions arise and sometimes some concerns. So here with some more insight, sponsoring today's health segment, Central Illinois Neuro Health Sciences, Dr. Jason Seibly. It's good to have you, Dr. Seibly.
Thank you for having me.
A lot of people think and feel emotionally when they have that nerve, that recognition that I'm going to have surgery on something that might be a little sensitive. And so you deal with folks a lot in those kinds of questions.
Yes, I do.
Yeah.
It's real common for somebody to be nervous when they're about to have surgery. In fact, back surgery has quite a stigma to it, and people are often scared of having back surgery or spinal procedures in general.
But I imagine that the technology and the methods of care have evolved tremendously over the last decade, or even certainly two.
They have. I mean, back in the 70s and even the 80s, back surgery was several days in a hospital and body cast, and you were laid up for a long time. Nowadays, most surgeries, you're up and walking within hours of surgery, even home the same day.
Yeah.
So it's much different than it used to be, and a lot of people's fears really aren't needed anymore because it's pretty straightforward.
Yeah, well, and you guys specialize in minimally invasive surgery, and I'm sure that puts a lot of people's minds at ease.
We do. In fact, I don't even really like the name minimally invasive surgery because nowadays most things are minimally invasive. The thought of minimally invasive surgery means to do the least amount of harm to healthy tissue as necessary, and I think that should be every surgeon's goal, is to try to sneak in and sneak out without causing any damage to the normal tissue and just get the job done.
Sure, well, and that's a really good approach, and I think it works it out nicely, and because you're also an educational institution, so you're training these folks for the future too.
We are, and that's one of the big advantages about our practice is we're training neurosurgeons of the future. We have 11 residents that I train every single day to do eventually my job.
Yeah, not quite yet. He still wants to do it for a few more years.
A couple more years.
Yeah. Well, and I'm sure that there's the need too, because we can. You never know when you're going to be in an accident, or you're sitting wonky and you're distorting yourself. I mean, there's lots of things that can go into affecting how your body moves and functions, especially in the back. And you guys really do a lot of different things and offer a lot of services that help folks with that. Tell me a little bit about some of them.
Yeah, our services are fairly widespread. Being neurosurgeons, we treat basically everything from the top of the head to the bottom of the feet. Anything involving the nervous system. So we treat brain tumors, spinal disorders of the neck, the back, disc herniations, carpal tunnel surgery, pretty much anything that involves the nerve or the brain or the spinal cord we treat.
Yeah, well, and the age group for treatment isn't just, senior citizens, because I think there's a stereotype for that too. But I mean, I could tell you in my late 20s, I slipped a disc in my back, and that was so painful. And that would be something that I could have you guys help me treat.
Oh, definitely, yeah. All age ranges, all the way from teenagers to people in their 90s. I mean, there's really no age cutoff to have spinal problems or need spinal surgery.
Yeah, and do you use lasers? Because I know that's a big thing.
That's a great question. I'm glad you asked. And I'm asked that every single today. And actually, the use of lasers is more of a marketing tool than anything. Lasers, when it comes to surgery, they burn and they cut. I have a lot of tools that burn and cut. So the use of lasers in spinal surgery there's really no advantage. There are fields of medicine like ophthalmology, for example, where lasers are very crucial for retinal surgeries and LASIK and cataract surgeries.
Sure.
Surgeries are very important and have really changed the field. But as far as back surgery, there's really no advantage to lasers.
I think there's this sense that it's precise, but that's something that you achieve in a lot of different ways as you practice and as you go through a surgery.
There are, and a lot of it, as you mentioned, is practice. It's doing this for many years and developing a skill and a finesse, and that's why it's 7 years of training to become a neurosurgeon, and then many more years after that, perfecting the art.
I'm not sure I recognized it was that much study. So, so you're 30 when you get out of school before you even start this.
Yeah, you are actually. You're over 30. It's 4 years of medical school and then another 7 years of training after that.
Wow. Well, you're definitely well trained and well experienced at this point. So what other kinds of treatment options do you guys pursue?
Great question. So we, as a surgeon, focus on the surgical treatments. Now, with back problems in general, there are treatments, physical therapy, spinal injections, sometimes just rest, exercise, but we focus on the surgical treatments. So, for example, anything as small as a disc herniation, which is about a 30 or 40-minute surgery that's done on an outpatient basis, to extensive spinal reconstructions.
Wow.
somebody has a car accident, as you mentioned earlier, and they have a major fracture or spinal cord injury, sometimes those require very extensive, very long surgeries, and we do that as well.
And so you operate separately from all the hospitals in the area. You guys are specialized.
We are specialized. We do operate at the hospitals.
Sure.
And both in Bloomington Normal and the Champaign-Urbana area.
Okay, so, but they would arrange to have a consultation with you guys.
They would, yes,
Okay.
at the office.
Excellent. So you definitely need to check that out. If you are in the situation where you need to have some surgery, you want to be able to count on having professionals with all this degree, all of this experience, and all of these many options to help treat you. So Dr. Jason Seibly is with the Central Illinois Neuro Health Sciences. They're sponsoring today's CI Health segment, and there's more information online which we will connect you to at ciliving.tv. Dr. Seibly, thanks for being here.
My pleasure. Thank you for having me. Thank you.